everyone. Welcome to today's live stream webinar, Meet the Experts, How Google Cloud Helps Healthcare Organizations Enhance Human Health and Wellness. Before we get started, I would like to go over how you can be involved in today's event. You'll have an opportunity to submit questions throughout the session by clicking the link in the description below. We will get to your questions at the end of the presentation. The session will be recorded and available to view on demand following today's live stream. If you need to get in touch with us after the event, we will send a follow-up email to get your feedback and comments. And if you have any additional questions, you can ask them there. Today, we will be discussing why Google Cloud Platform is the right fit for healthcare and life sciences industry, healthcare API, simplified security management, data management and smart analytics, AI and machine learning. I would now like to introduce our two experts for today. Polly Israni, Providers and Health Plans Marketing Lead at Google, and Michael Ames, Senior Director of Healthcare and Life Sciences at SADA.
Thank you, Samantha, for the introduction. So I want to just jump right into the conversation, Michael. And I thought it'd be great to start with something that's really topical right now. So there's a lot of stuff we can dive into on this topic, but I want to start with how has COVID-19 affected the work that you've been doing over the last 3 months at SADA?
Yeah, good timing, Polly, for a number of reasons. First of all, just on behalf of myself and Polly and others, thanks everyone for joining today, and we hope that this time is useful for you and time well spent. I was just talking to my wife yesterday about 8-10 weeks ago how I'd mapped out my travel plans for the next 6 weeks, and it was all color-coded, and I had it hanging up there on the kitchen wall, and how one by one all of those dissolved to nothing, and I haven't been to the airport in months now. It's an odd feeling. So I think we're all feeling that kind of change to lifestyle, and that can be stressful. But I am really grateful to be involved in an industry that there is an opportunity to try to do something about it. And so we have been super busy in the SADA Healthcare and Life Sciences group on a number of initiatives. One, part of why the timing is so good here, and purely coincidentally, today is the launch of the National Response Portal, which is a new collaboration built and managed by SADA with collaboration and support from Google and HCA Healthcare and others to bring together data and forecasting models and mapping information and all kinds of useful things about what's happening with COVID. Lots of portals and lots of maps and things out there. We're trying to be complementary in our efforts here with a real focus on helping decision makers in government and healthcare be able to anticipate what's next. We put a lot of emphasis on things like the interaction between social policies, social mobility, and COVID-19 outcomes for virtually every county in America. So you can go drill down into your county and see, okay, what kinds of stay-at-home orders are in place? How is that affecting whether or not people move? And as people move, how's that affecting the flow of the disease? Within the next couple of months, we'll start to release additional things like some really advanced, exciting new forecasting models for new diagnoses and ICU and ventilator utilizations and lots of things beyond. So that project has been occupying an awful lot of our time. And has been a great one. A couple of other things, of course, that we're really happy to be involved in. That these aren't, none of these are money makers. These are all greater good projects, but it's just great to see the way that the industry can come together. We are working with a number of hospitals. We have worked and continue to work with a number of hospitals to deploy technology into patient rooms in order to help patients who are have to be isolated to be able to have video communications out with their families. It's a tragic situation that we have to be working on that, but given that problem is out there, again, I'm grateful that we're in a position to be able to do it, as well as a variety of other things in telehealth and things like that. But it's certainly upended any plans that we thought we had for Q1, Q2, as I'm sure it has for everybody else on this call. I'm curious, Polly, in your work, I know that you spend a lot of time in AI and ML, and I'm curious, when it comes to the coronavirus, how are you seeing organizations apply those technologies in order to help solve their problems in the context of coronavirus?
Yeah, that's a great question, Michael. And I think the example you gave is such a great example, like the work that SADA's doing and leading with combination with HCA and with us around the National Response Portal is such a great example of where data can help these communities and in a bigger sphere of public health understand populations at large. So we see data at the crux of this movement right now. Data was already a very important player, but I think right now there's an incredible spotlight on it because that's our only window into understanding how this virus is moving through our community, country, county, world. Really, it's that data piece. So I think the National Response Portal is a great example. Like in that case, you can get all kinds of insights across all kinds of important and urgent questions that people might be asking about coronavirus, such as how to better allocate PPE between different institutions, how to partner together. The collaborations we're seeing amongst providers is astonishing, just given the need. But I think there's so many other things too, like triaging the most critical inquiries that come in through contact centers. We're seeing a lot of interest in contact center AI and just leveraging AI to better manage the increased volume of inquiries coming from patients and people across the community. And then along the lines of the PPE, just monitoring and reducing capacity issues. There's like, I kind of separate into two categories. There's the clinical and operational piece, which is how to use the data to give visibility into doing things in a different way and faster and more efficiently given the current situation. And then there's the research piece. Like, how do we attack this head on, run algorithms, and be able to understand at a massive scale the protein structure of this virus and do that compute so that as we're running clinical trials and other things, we can do these massive studies and simulations to understand what's going to give us the best pathway to getting out of the situation too.
Yeah, so given all that, we're seeing on the healthcare side significant transformation occurring post-COVID that probably should have been happening sooner, right? So the massive expansion of telehealth, and by the way, we'll get to our Google Cloud topics here in a minute, but this is just interesting to me. The massive expansion of telehealth in response to the virus is not something I think that we're going to go away from as an industry when this is done, right? That's going to balance back out. Are you seeing the same thing if you're going to compare prior to the virus and now? Are you seeing changes, and do you think any of those changes are sticky?
Definitely. I mean, I think before COVID-19 even, we did see there were tons of organizations already on a digital transformation journey, and the majority of those did include embedding AI ML into their technology stacks. And, we were starting to see examples of telehealth and all that, but nothing has been a bigger forcing function than this pandemic. This pandemic is really forcing organizations across the industry to rethink their relationship with technology and fast track the adoption. So I think with the fast track adoption, these technologies are also here to stay. People are realizing as we go to telehealth models that a lot of these appointments can be done remotely, and there's no, even if it wasn't for this virus, there's no reason to increase your exposure to other things when you can do that same appointment just as well from home. So I think there was a recent discussion with Chris Ross, the CIO of Mayo Clinic, and I think he described this incredibly well. He was thoughtfully exploring what might have happened if this pandemic actually arrived a decade ago when our industry was mostly paper. And as he described it, things that we've been working really hard on for 20 years have now been battle tested. So these are all things that were in the plan anyway, but now we're battle testing it. In some sense, we're going through our own real world trial of this technology. So I think we're in a really interesting space than prior.
Yeah, agreed.
I'm also curious. So Michael, you're also coming from an interesting background. So coming from the Colorado Center for Personalized Medicine, you've dived deep into data and looked at data on a very personalized level to improve patient health. Tell me about this transition to Google Cloud and how that's been for you. What are some of the markers that you feel in this transition between Colorado Center for Personalized Medicine and then coming to SADA?
Yeah. So my first dips into the Google Cloud waters were about 5-6 years ago. At the Colorado Center for Personalized Medicine, we launched the first ever full PHI containing enterprise scale health data warehouse and analytics platform. We think on any public cloud. I'm going to keep saying that until somebody contradicts me, but I think bar none, any public cloud, anything enterprise scale with PHI, we were the first into those waters. And that was scary at the time, but it was so fantastically successful for us that over the next few years, we were able to build on that technology to accomplish some amazing things. There was press these last couple of weeks about a new partnership between the Center for Personalized Medicine and Regeneron to help drive forward new genomic-based diagnostic processes and new personalized medicine treatment paths. And all of that collaboration is enabled on this platform that we built on Google Cloud, and it was exciting, and it remains a fantastic world-class organization. Was tough to lead, but the opportunity to come out and work with people in order to help bring those technologies and replicate that work in many other organizations was what was so exciting, and specifically coming to SADA, which is around building of those specific solutions for customers. Google creates these great Lego blocks. We take those Lego blocks, we build them into solutions and exciting products and toys for our customers. So that was really what drew me. And it's tough to pin down one specific technology that says, here is the thing that makes the difference. It's really, I think, the confluence of higher order services that are simpler and easier to manage. So things like BigQuery. I've always said if I get one tattoo, it's going to say BigQuery, and it's going to go right here. Because if you are in the business of integrating and aggregating data and using it for analytics, dollar per capability, there really isn't anything else like it on the market. And we were able to use that to integrate data from millions of patients, hundreds of thousands of genomes, and use that as sort of the beating heart of this data warehouse and analytics platform. And tools like that enable folks in healthcare who are working on how to leverage data for actionable insights are indispensable. And to be able to use those tools without spending really any time at all worrying about infrastructure is important. So that, coupled with best-in-class security, really great kind of zero-depth entry pricing models, I think is what has made for me and for many of my colleagues, Google Cloud a really appealing choice for healthcare. I'm curious, you spent your time in other kinds of organizations. I came from academia, you came from Salesforce, Intel, Google. You've watched these things evolve over the same time. What are you seeing there, and what do you think differentiates Google Cloud as a cloud platform for healthcare relative to your experiences?
I mean, if I had to summarize this in one way, like one thing that I think is so different between the early 2000s to now, it's scale. So, I mean, at the time, I was working at Intel in the supercomputing division, and at that time, some of what those supercomputers could do is now we can do in a mobile phone, right? Things have changed so much. So digitization of information in the healthcare space too, there's just been so much that's happened there with meaningful use, a lot more EMR usage. So I'd say in the mid to late 2000s, some of the questions around healthcare technology were centered around how is technology going to improve the process for caregivers? And there was a lot of skepticism around it. The data was pretty narrow in scope, so there was not a whole lot you could do around it. It was more around cart on wheels and different services you could bring into the hospitals and like, frankly, wiring up some of the hospitals at the time. But around the turn of the decades of 2010, 2011, you started to get more into the scale of data, and the questions were around how can cloud help us better operate and deliver better patient care? Now in 2020, I think the scale is incredible. So now the volume is there. And it's been, particularly around this unique time, it's been inspiring and uplifting to see the coordination and collaboration across all these different hospitals and healthcare institutions. So I think our question evolves into how can data help us better understand health patterns and serve our populations at large? Now, we were going to that anyway before this, but I think with COVID-19, there's a particular call to action for all of us to really work together with our data and figure out how we can understand what's happening.
Yeah, that's awesome. And I want to skip ahead here to another question that I think might flow from that. We've talked about for a lot of years the triple aim of healthcare, and recently we have expanded that now to a quadruple aim. I don't even feel like we'd mastered the first three. when somebody decided we need a fourth one. But this idea of provider satisfaction, I think, has really arisen out of the recognition, I think well studied at this point, that healthcare providers who are happy in their work provide better healthcare. And so toward the goal of improving patient outcomes, we need to focus on improving the healthcare provider experience. So from your view within Google, what is Google doing? What are the solutions that you think that are aligned around helping us to achieve that now fourth aim of provider satisfaction?
Yeah, I think in that category, it's a really good question. The improving the caregiver experience and reducing physician burnout are definitely topics that we talk about a lot at Google. Um, so in the number of hospitals that we work with, helping them streamline administrative processes and offering them insights that simplify workflows is a big part of it. So we were talking about some of the data and how that can help with clinical and operations and also can help with the research side. I think with that clinical and operationals, the more that you take that operational burden off the physician, the more time they can spend with the patient. Um, and so now in this virtual world where a lot of physicians might be offering support remotely, being able to offer them the tools to provide telehealth, being able to make the technology simple for them and to eliminate steps for them versus adding steps for them in terms of delivering that patient care. So it's all about empowering the caregivers and giving them back time with patients. There's a number of different solutions that we have there. So I think CCAI is one that's really been, there's been a big light on it recently because all the contact centers are getting flooded with volumes of patients that have inquiries. And so rather than patients going directly to the physicians, a lot of times in the contact center, you can address some of the basic questions there and use AI to handle some of the intake and the way that these questions are answered.
Right.
And then on
Yeah.
top of that, oh, sorry, go ahead.
For the benefit of listeners here, CCAI is Google's AI-driven engine to help automate contact centers for folks inbound chats, voice contacts, any of those kinds of things. And in addition to the sort of generalizable technology that Google's created to enable help desk, service desk, those kinds of things through automation, Google has also enabled a COVID-19 specific sort of prepackaged CCAI offering to help organizations who want to give customized, easy flowing Q&A around COVID-19 questions and issues. That sort of comes out of the box, and it requires some implementation, but it's prepackaged.
Thank you. That's a really good addition. And that specific SKU that Michael's talking about is the rapid response virtual agent for COVID-19. So that's pre-populated with some of the questions that are coming up most frequently around COVID-19. Just to add like a couple other things there. So we are also seeing a ton of interest around G Suite just to help to optimize some of the processes. Collaboration has been a big topic within the hospital and how these caregivers can communicate not only with each other, but also with the patient. So there's a telehealth piece of it, but there's also communicating within the care teams and within the other communities within the hospital. And that we're seeing a lot of interesting uptick in G Suite from that.
Yeah, so as we work with healthcare customers, that's a piece of technology and what you just described, the ease of collaboration is the thing that healthcare organizations find is valuable in G Suite. There might be cost advantages, there might be security advantages, manageability. There are a lot of things that the IT department and the finance department cares about, and those things are all good and they're there. But what the users care about is the frictionless online communication, especially in this period where everybody is working from home and independently. So if anybody this week has already had the problem of passing around different versions of a document that you're sending as email attachments, and you're wondering, oh, wait a second, my changes didn't get added in there, then we should have a discussion about that, because that kind of collaboration is a layer of friction that over time adds up to some real challenges and starts to interfere with the provider satisfaction that we're trying to improve upon. And our healthcare clients who who have made that leap to G Suite and those really seamless collaboration tools report back very high user satisfaction on that piece alone, right? It's ease of communication and collaboration that makes a difference.
So Michael, while all these different institutions are moving quickly and taking this big leap, as you say, and trying all these new technologies, how do you make of the security piece of it? Like that's all the major cloud providers are offering HIPAA compliance and strong
Yeah.
security. So I'm curious to get your take on some of the customers you're working with and what you see in Google's security infrastructure that's helping with
Yeah.
that security piece.
Yeah, absolutely. Like I say, I'll repeat again my claim to fame, and I'm gonna add to it. Okay, so not only were we the first to launch 7 million PHI records into the public cloud, but this was part of a 4-institution consortium. 2 hospital systems, a physician billing organization, a university, all of whom owned different pieces of those patient records in siloed systems, independent organizations with their own CEOs, IT departments, and legal departments. So to make this move in 2015, 2016, we had to convince 4 each: security officer, privacy officer, legal officer, and a regulatory compliance officer that this was okay. And until we got the consensus agreement of all of those people, for whom their basic job description boils down to just say no, right? We could not proceed. And we did that before anyone else. And I have to say, the thing that was true then, that is true now, that differentiates Google Cloud for HIPAA compliance and security is not that it is less hackable than other cloud providers, because we know how to do strong technical security now. It's that security management on Google Cloud, I think, is demonstrably simpler than on other platforms. And I can state that with strong bias, but also strong experience in that space. Fewer switches to flip means fewer things to mess up. And if you follow this news like I do, because I'm a glutton for punishment, every day the news releases on where the PHI breaches were around the world. The vast majority of them that you find out that are cloud related are someone putting PHI into a cloud storage bucket and leaving those permissions open, right? So it would make sense that if you want to reduce your exposure in that area, you would adopt technology that makes it very, very easy to ensure that you have not done stupid things like that that are going to expose your data. So not only the sort of simplicity of the Google Cloud management, security management pane, but also a really great ecosystem of tools that help to provide automated additional monitoring on those things. You've got Forseti, which is world-class open source tooling. You can say across this organization, we should never have anonymous access available on a Google Cloud bucket, period. And not only will it constantly monitor and make sure that you're not doing that, but if somebody does make a change, leave something open, it will come through and heal that error, send you a report, and you can go react to that. So those are the kinds of things that I think differentiates Google Cloud security, and were instrumental in our being able to convince a highly skeptical group of folks that we could store their data safely on the cloud, because we could show to them, we know how to manage this. It's actually not that hard. That's what I think is important. Now, I come into that conversation, Polly, very early, because my background is in systems design and architecture, and so I start thinking about security the moment that people tell me that there's going to be sensitive data in there. You're looking at this from a higher point of view. Where in the stage of dealing with data on the cloud do you start to think about privacy and security? How do you work that into the projects that you're involved with?
When we work with our customers, we work this in from the very beginning. So it's security and privacy is something we take very seriously, and even starting from the data collection process, we're transparent with the data we collect, and we give controls to our customers and partners to manage their privacy. Ultimately, our customers and partners are the owners and the stewards of this data. So we work with them. We work with experts and partners like you all, so we can encourage them to think about privacy and security from the very start. I think now, especially in this time where data sharing and collaboration are going to be a reality of how we move forward in this new health environment, they're such an important part of the research process. They're an important part of right now how we operate. globally and how we work within a community. So they need to be designed in such a way that they're going to be compliant and with privacy regulations. So I think this data sharing piece is going to increasingly become more interesting over time, because we're starting to see some very interesting collaborations happen there. I think one other thing along those lines too is this de-identification piece in particular, because we're looking at now a lot of population health type of data. Our customers are, and our public health institutions that we work with are. So to give an example of just the type of products and solutions investments we're making in this space, de-identification is one of them. So we have a solution called de-identification as a service, and it is extending the product capabilities by engaging partners to provide the hands-on expertise in the data migration piece, the de-identification piece, and the de-identification quality evaluation piece to customers. So these are skills that few of our customers possess in-house, and therefore providers don't need to go and seek out that expertise and need to hire it in. Instead, they can lean on SADA, they can lean on Google Cloud solutions to provide them with that value in terms of making data available for the analytics, AI, ML, sharing, licensing, and other critical use cases that are going to help them to leverage that data and understand it in aggregate, without having to worry and stress about the security and privacy piece of it.
Yeah, love it.
I mean, so I think when we talk about security too, a lot of the stuff that goes hand in hand is this population health and aggregation of data. So I'm also curious to hear your thoughts on AI/ML and this aggregation of data. What do you see that makes it so special about some of the use cases you're working on in healthcare?
Yeah. I mean, I love that you were talking about de-identification there. As a Google Cloud customer 2.5, 3 years ago, we were involved in some of the early product development work that Google was doing there, because as you said, that is a really, really hard problem to solve, and it's a hard problem to solve at scale. And so Google taking that on and saying, here is an industry-wide challenge. Perhaps we within Google can solve this one time and solve it really, really well, and then others can build solutions on top of that in order to meet that need. I think that is one thing that makes AI/ML for healthcare special with Google Cloud, is that Google has that specific industry focus. Again, like I said before, Google is building Lego bricks that we're using to create solutions, that SADA uses to create solutions. But in some of these cases, Google is building, we'll call them healthcare shaped Lego bricks that are specific to the industry, if not specific to any one solution or organization. And that's just gives us so much power. We're working with an organization right now that has petabytes of DICOM stored images, radiology images and others, that would be a tremendous research resource. But certainly, as folks on the phone understand, DICOM images have burned in text, which is often identifying. So we're working with them right now on a pilot project where we will take hundreds of thousands of these images and using some, I'll be honest, I don't want to undervalue the work that SADA is providing here, but the lines of code that it takes to say, take these hundreds of thousands of images, run them through this de-identification process, and give us back images with all of those potential identifiers, not just correctly statistically identified and then fully blanked out, redacted, tokenized, moved somewhere else so that we could actually come back, re-identify if we need to, continue to use that information. 40 lines of code. I mean, it's just not much, because the tool itself is so well architected. It's an API call for us. We're going to help this organization learn how to do this. We're going to give them the 40 lines of code, and then they're going to go to town and build that into their solutions. And that's going to have impact on their ability to use these images for research, and that's going to have an impact on human health and wellness. So that kind of thing, I think, makes Google Cloud very special for healthcare. In addition to, I think it's fair to acknowledge that it's not that Google has invented all of the machine learning technology out there, but Google is certainly the organization that has done the most worldwide to make machine learning technology accessible and useful and fast, right? So whatever your machine learning challenge is, chances are your data scientists are already using Google technology to solve it. Using Google Cloud's tools to put infrastructure under that to make that really easy is also kind of magical. When you marry up the development technology with auto scaling, pay as you go pricing, and very, very little infrastructure management, you can enable those data scientists to get things done. In my mind, the calculus that I always ended up doing is, by doing this work using Google's managed infrastructure on the cloud, I can then hire one more data scientist instead of one more IT infrastructure manager. And which one of those is actually going to help me to differentiate and deliver value faster? It's going to be that data scientist. So those are the things that get me, very excited about the opportunities for healthcare data on Google Cloud. There is a universal problem, Polly, which is you cannot do good data science without good data. So why don't you talk a little bit about what Google is doing through your solutions and partners to help people make sense of the data that they have?
Totally. And I think it's like the quality aspect that you touch on, like, can you trust the data? And then you need good data. And the other piece is you have tons of data. So how do you deal with that massive volume and that data in different silos? So when it's siloed, you obviously miss the full story. You also don't know which data to trust, which ones to piece together. And then you can't really benefit the patient if you don't have this clear coherency around the data. I remember in a lot of our discussions with CIOs, this is around Chime, a number of CIOs shared their struggles around big data analytics. Aggregating the data specifically is manually very time consuming, very error prone, and just not a long-term solution. So with a lot of our customers, actually, Colorado Center for Personalized Medicine, where you were at before, was one of the examples that we always give in this, just in terms of ingesting all types of healthcare data and really leveraging it for these difficult computational problems that previously would not be able to be done at the scale that you need to do it at. So it's enabling our customers to do more meaningful analysis. We're seeing, so there was an organization, an academic institution I was talking to 2 weeks ago that's processing petabytes of healthcare data right now around coronavirus and turning this massive amounts of data. In this case, I think mostly they were using protein structure data, but really you could be doing this across genomic, imaging, clinical, insurance data. There's all the different data types to get to those next healthcare breakthroughs, to get to better care, and to get to more streamlined operations. So between us and our partners, we want our customers to not have to worry about that data coherency piece. That's the piece that we can help with, and helping them to take that and bring it into our data pipeline. So they could bring all these different data types, all these different sources of data in these different silos, bring it together, be able to sort through that and figure out and organize it and figure out how they can leverage that for cloud machine learning and replace some of maybe the previous paper and film practices that they might have been doing before.
Love that. Love that. So I'm just going to make an observation on the conversation that we've had so far. And I don't think that it was planned in this way. I just sort of realized this is what has happened. We have not really spent any time talking about lifting and shifting bare metal servers or virtual machines onto Google Cloud. We haven't talked about identity management and all of those sort of fundamental cloud capabilities. All those things are out there, right? And Google and their partners like SADA, we can help organizations to accomplish their needs there. What I have loved about this conversation, though, is that how much there is to talk about in the things that we're actually doing to improve and impact human health and to make the workday better for providers and to make, actually have an impact on this industry that we all care about very deeply. So I think I wanted to first acknowledge that, don't worry, those other things are there too, right, for folks who are listening here. But also to point out that when we're talking about healthcare on Google Cloud, we really are talking about organizations that are very focused on figuring out how to use this technology to do the right thing and to help organizations close the gap between where they are now and what it is that they're trying to accomplish from a business and a scientific and a clinical perspective. And I think that's really cool. And again, not something that we planned, but here we are. Related to that, we're trying to help make the world a better place. Let's shift just very briefly from what we're doing with the healthcare industry to what we're trying to do for human wellness in general. I just saw the news that Google is giving all of their remote employees a $1,000 budget to buy stuff to work from home. I'm sure that makes a lot of people very happy. I'm also sure that's the tip of the iceberg. What's Google's perspective on wellness in populations in the age of COVID-19?
Such a great question. And I was going to say, just observing the conversation too, we have spent a lot of time talking about human health and kind of the operations, but wellness, like when we talk about that quadruple aim and the fourth pillar of supporting physicians and caregivers, wellness is going to be a big thing for providers too. So I'll talk about what we're doing at Google, just some of the highlights that I've been seeing as an employee, and then how we're also applying a lot of that to providers and the conversations we're starting to have with providers around wellness. But I also think this is a really interesting and timely time to talk about wellness because we're in Mental Health Awareness Month right now. So never before has there been such a spotlight on wellness and mental health specifically in the midst, as we are in the midst of a global pandemic. So I think in the past, when we talked about wellness, even within Google, there's a lot of different resources that are offered internally for us as employees, and we're all very grateful for that. I think right now it's there's a spotlight being shined on it. So some of these offerings that were there before are here now, and we're just more aware of them and more appreciative of them, frankly. Some of them are collaboration tools. Some of them are the apps, like some of the digital health apps out there that are good for meditation and for managing stress during this time, and also just enabling us to work remotely. It's a really um, unique time where everyone is working remotely, including a lot of healthcare too, where if your job doesn't require you to be in the hospital, working remotely is really important, and managing your balance and managing your wellness there is important. So we're seeing people use technology in a lot of interesting ways, from supporting patients, the whole telehealth piece that we were talking about, caregivers and employees during this time. Meet for Telehealth is something we spent some time talking about earlier, Michael. And I think that use case for mental health services being offered virtually is very big. I think even prior to pandemic, that was one of the use cases that was most prevalent on telehealth, and there was a lot of providers starting to use it for that. But now we're seeing this meet being used for a lot of other telehealth use cases, and I think it's only increasing and it's only here to stay. We'll continue to see more. So I said those are the big things that come to mind around wellness. I think also the collaboration tools and G Suite that we spoke about, just helping people connect in remote environments, helping people feel connected in general is a big theme. But I'd also be curious to get your take on that.
Yeah, no, it's huge. SADA, I think, is doing this really well. We have we are able we drink all of our own Kool-Aid here, right? So our teams are all day long collaborating on Google Docs. We're face to face on Google Meets. We are using all of this technology to keep as connected as we can be, and we have excellent company leadership that is taking an active role in ensuring that every member of the company has their physical and emotional needs met, and they are using the technology to help us figure out how to do it. So it's an honor to be a part of that. I actually, so Samantha here, our moderator, is involved in some of those efforts within SADA, and so she could probably speak a little bit more to what some of those things are. And we have published some resources that are available to other folks that may be of interest. Why don't you talk about that, Samantha?
Yeah, so due to all of this and having to shift so quickly from a, in work, in office environment to a remote environment, we pivoted really quickly and we actually came up with Cloud Quarters. Cloud Quarters is a portion of our website that is like a go-to hub for information, tips and tricks, how to use the Google products to contribute to productivity and collaboration. It's a portion of our website. So if you go to this link, sada.com/cloudquarters, you can see all the information, guidance, tips and tricks. We've been growing this collection since the beginning of this pandemic and working in this remote environment. So it actually makes life a little bit easier when you're working from home. We have plenty of videos and ways that you can get the most out of Google products. So it's actually a really great resource that I even use myself. So, but I think we have a few questions that came in from the audience. So if you guys don't mind, I'd love to ask you those questions.
Sure.
Let's see. First off, I know that NRP, the National Response Portal, just released today. Is there a bit more you can speak to that, Michael, and how Google helped to power that?
Yeah, happy to. So first of all, you should go to nationalresponseportal.com and read up and read the about pages and read the FAQs and probably get most of your questions answered that way. And absolutely click the big purple button to go to the portal itself and start exploring the data. This project was envisioned by HCA Healthcare. They haven't bought it. They're not paying for it. They aren't they aren't owners in that sense, but as one of the nation's largest private healthcare providers, they had an opportunity to make an impact, and they came to Google and they said, here's this idea. We think that we could use our influence to gather together a coalition of hospitals who could provide daily data on COVID-19, and that could be used to build better predictive models and analytics to help people understand the spread of the disease. Google said, great idea. They came to SADA because of our history and impact in the healthcare space and asked us to build that for the community. So we've done that. It's been done as a greater good project. There's no cost to participate, no cost to access or utilize the data. I'll also point out that COVID-19 is not in the name of the portal because if we do this right, we'll do a little part toward helping end the crisis sooner than later. But this resource, this platform that we've built, continues to have value in helping us to plan and prepare for the next infectious disease, the seasonal flu cycle, and even other emerging national crises that may not be directly health related, but have health consequences. Hurricanes, tornadoes, floods. We're looking at how those things intersect with social distancing orders. What do you do when you've got a state under social distancing orders and a hurricane is coming through and you normally pack people into the high school gymnasium for shelter, right? How do we prepare for that better? And what data can we provide and what insights can we offer to help governments understand what may be coming so that they can be prepared in advance? So this thing we expect will have long life and will continue to be a resource to support us in a variety of challenges that may be coming down the road. It is ultimately owned and managed by SADA, built in collaboration with Google Cloud, and available again as a greater good project to the community.
Great. All right, I've got another question here. With the healthcare companies you've partnered with to enable their AI/ML journey in the cloud, what challenges have you faced along the way?
I'll answer, and then Polly add whatever color from what you're saying. We talked about how you cannot do good data analytics until you have good data. Machine learning is amazingly resilient against data that might be incomplete or fuzzy around the edges. But until you have the ability to actually aggregate that data together in one place, it's hard to take those next steps. Until you have environments where you can feel safe and secure processing that data, it's tough to actually write the code that you need to process it. So we spend a lot of time helping organizations prepare the data for analytics, prepare the environments for analytics. And once those things are there, their data scientists can rock and roll with it. What do you think, Polly?
I think that covers a lot of what I was going to speak to. So I'd say two things, like the two challenges that come to mind are interoperability and security and privacy. So we spoke a lot about the security and privacy piece. So I'll just spend a minute on the interoperability piece. And Michael, I think you covered a lot of that. It's like, how do you prepare that data for all the analysis that you need to do? A lot of our healthcare customers, they have a lot of data that they want to bring into cloud securely, but the problem is the data is stored in so many different formats and silos, as I had mentioned previously. So the interoperability, creating the consistency and actionable insights from that is really important. So that's where I'd say healthcare API can help them with the ingestion of all that different types of data and through that pipeline so you can do meaningful analysis then.
Yeah, I think for data flowing from, particularly data flowing from FHIR-enabled systems, HL7-enabled systems, healthcare API is amazing for its ability to connect and to integrate that data using standard mechanisms and in sort of a non-disruptive way. For traditional ETL, we love tools like data flow and data prep. There's an entire, for every tool that Google provides on Google Cloud for helping you to analyze data, there is a tool that helps you in some way to prepare that data for analysis. And so for those data sources that might be more of a traditional ETL or might be streaming and they may not be FHIR or HL7 compliant, or even potentially downstream from the healthcare API as an initial integration hub, these other tools can be used to help prepare, condition, format, shape the data, and get it ready for analysis. And those tools are fun to work with. We actually have found data scientists who quietly admit that they actually prefer that data preparation, data wrangling effort to the actual building of models, because they find the tooling there and the satisfaction of shaping that data is as good as building those predictions.
Great. We have one last question. Do you see a role that AI ML can play in addressing some of the health inequities and supporting the most vulnerable that are being impacted by coronavirus?
Oh, I have some thoughts here, and this is just something I'm really passionate about personally. But Michael, I'm curious too, if you feel free to have the first crack at this, if you also have some thoughts on this.
Sure. Yeah. Here is, some of what is interesting about machine learning. If you do it right, I'm pausing here because there's a risk here of data malpractice that I want to make sure that I'm not crossing here. Part of what makes machine learning magical is its ability to generalize models, right? And if done right, it means that we can begin to build an understanding about general patterns of human behavior and health, even from limited data sets to deal with vulnerable populations. So I'll give you an example of that. Within the National Response Portal, we're working with an organization that provides healthcare for prison inmates. This is a very important population. The transmission and spread of a disease within a prison system, though, is very different from how it is in the general public. So we don't use that data in the same way as we do other data to help us model and understand the progress of the disease for the general population. But there are absolutely insights that we can glean from both general population data and prison data that help us to understand what may be happening in the other. We have to do that carefully, but these are the kinds of things that AI and ML can do well. In fact, when I think about what do we mean by AI, I think about human intelligence and our ability to learn something over here and then apply it in other places without necessarily having to start again collecting data and reanalyzing. And so there are opportunities for us to use that technology to glean insights that may help us to service underserved and vulnerable communities, even while providing extra care and protection to the data that surround some of those vulnerable populations. What do you think, Polly?
It makes a lot of sense. And I think the data really is at the crux of it. Like when I see it at Google, I think of the data as uncovering those blind spots. So being able to get visibility around blind spots that you may not have known existed is one big part of it. So being aware of where the problem is. And then I think the other piece is the efficiencies, because a lot of not being able to serve some of these populations has to do with bandwidth. So the minute that you can create some of these efficiencies, operational efficiencies, you can then free up some bandwidth and better serve these populations that are coming into the hospitals.
Probably, I love that. So going back to the conversation about the call center AI, there's a really good example, right? So as healthcare organizations have reached out to us on call center AI, what they have specifically said is we want to free up our staff to be able to work with people face to face and on the phone who need the help most. And if you think about deploying a chatbot, the population that may be best served by an online typing chatbot is going to be potentially different demographically from the population who's going to want to call and talk to a human being every time, or want to walk into an office and have a conversation with them. And so if we can use AI to free up resources, we absolutely can serve some of those underserved populations better. Hadn't been thinking that way at all. I think that's a really great example.
I think this is an interesting thread, because there's this piece, which is how do you serve those populations today? And there's also the how do you serve them in the future, the research piece of it. So we touched on a bit the research piece and how you could take all this data to get to the other side of coronavirus. But in my previous company, we used to do a lot around real world evidence and running real world trials. And this to me is a massive real world trial where we're taking all these data, running these simulations, we're getting all the data we can, so we can better understand the population. But it's going to be up to us globally to figure out how we make sure that those underrepresented populations are represented within the trial, so we can understand those populations.
Cool. Great question.
Yeah, good question.
Well, thank you, Michael and Polly. That was really great, informative. I certainly learned a lot myself. And I want to thank everyone else who joined us today for the live stream. Following today's live stream, you'll receive the link for the on-demand recording, and we'll also send you a survey so we can get your feedback, or if you have any additional questions, please ask them there. On behalf of myself at SADA and everyone at Google, thank you so much for joining us today, and have a great rest of your day.
Thanks, everyone.
Thank you.